The double pink lines. You know what I'm talking about? A positive pregnancy test. Only sort of. One line is so very faint. Could you be pregnant? Or is that the infamous evaporation line? Well, in this video, I'll help you ace that pregnancy test so that positive or negative, you'll know what to do next. Hi, I'm Genevieve Holland, the woman behind MamaNatural.com, the #1 natural pregnancy and parenting brand. I also offer a free pregnancy week-by-week series via email or text that tracks baby's developmental milestones and delivers simple, natural tips to help you and baby thrive. Sign up at MamaNatural.com/updates. Okay. Back to that faint line on your pregnancy test. This line can look different depending on which test you use. Most pregnancy tests uses 2 parallel lines or a plus sign to indicate pregnancy. If you take a test with a plus sign, you'll be looking for one dark vertical line, the control line, and one faint horizontal line crossing it. If you take a test with parallel lines, you'll be looking for one darker control line next to one faint line. Now, if you are testing early before you've missed your period, the faint line may be so faint it's barely visible, almost like a tiny, tiny smudge. The further along you are, the darker that line usually becomes. A true faint line is usually a true positive, and positive means positive, you're having a baby. Now, more scientifically, a positive result, even a faint positive line, means that implantation likely occurred and HCG, a hormone produced by cells surrounding the baby in the embryo stage, is being produced. Now, HCG is vital for sustaining a pregnancy. Can a faint line be negative? Very, very rarely. That's because pregnancy tests have one goal: to detect HCG. When your test shows a faint line, it means that your body is detecting some HCG. So what could be causing the body to produce HCG if you aren't pregnant? Well, 1, hormonal imbalances, things like PCOS. Sometimes ovarian cysts may release hormones like HCG even if you aren't pregnant. Fertility medication. Some fertility medications may trigger positive results before you're actually pregnant. So if you are going through fertility treatments, talk to your provider about when you should take tests. A recent miscarriage. If your HCG levels haven't returned down to 0, it's still possible to get a positive pregnancy test due to the residual HCG level. Menopause. Early menopause can trigger higher than normal HCG levels. Illnesses, specifically medications used for Parkinson's disease and epilepsy, can trigger a false positive. HCG diet. The HCG diet is a weight loss diet that incorporates this hormone into the treatment plan. So not surprisingly, if you're on this diet, you'll likely get a positive pregnancy test. And finally, sometimes you'll have a faint line because there was implantation, but something happened and the pregnancy wasn't viable. Now, how do you know if the faint line isn't just an evaporation line from your urine? Here's how to spot the difference between a faint line and an evaporation line. Thickness. An evaporation line tends to be skinnier than the control line. The color of the line. This is probably your most obvious indicator. Most evaporation lines will be gray in color, not pink or blue like the control line. Although there have been reports that the blue line pregnancy test can show a light blue evaporation line. So do yourself a favor, stick with the pink dye tests. Timing of the tests. Evaporation lines appear as urine evaporates, which means it takes several minutes for this to happen. So a good rule of thumb is just to follow the directions. Pee on the stick and look after the appropriate time. Don't go do some things and come back 10, 15 minutes later, because what you might be seeing is actually an evaporation line. What about digital pregnancy tests? Now, there is no mistaking the results of a digital test. They literally say pregnant or not pregnant. The only downside is that these digital tests are more expensive and they require more HCG to get that positive result. So if you're impatient like me and like to test before you get your period, it's best to skip these tests. If you still have doubts that you're actually positively pregnant, your provider can order a blood test for you. These are more sensitive than urine. And if you are indeed pregnant, start with your prenatal care and be sure to sign up for my free pregnancy week-by-week series via email or text that tracks baby's developmental milestones and delivers simple, natural tips to help you and baby thrive. Sign up at MamaNatural.com/updates. Finally, be sure to check out my book, The Mama Natural Week-by-Week Guide to Pregnancy and Childbirth. It's the first ever week-by-week pregnancy book from a natural perspective. More info at MamaNaturalBook.com.